Why do ACE inhibitors such as lisinopril cause a cough? Well, first let's look at how ACE inhibitors decrease the blood pressure. ACE inhibitors like lisinopril block a substance called angiotensin-converting enzyme. Without this enzyme, the body cannot convert angiotensin 1 into its active form, which is called angiotensin 2. Angiotensin 2 is responsible for vasoconstriction, so without angiotensin 2, the vessels are able to dilate, the blood flow is increased, and blood pressure is decreased. However, angiotensin 2 has other functions, including breaking down a substance called bradykinin. Bradykinin causes inflammation, and in airways, bradykinin triggers bronchoconstriction. Bronchoconstriction causes narrowing of airways. One of the symptoms of this include a dry, persistent cough. Basically, ACE inhibitors inhibit angiotensin 2 from forming, and without angiotensin 2 to keep bradykinin from building up, the bradykinin levels increase and lead to inflammation, which leads to bronchoconstriction, which leads to cough. The ACE inhibitor cough is thought to be influenced by age, gender, and concomitant disease. However, the ACE inhibitor cough seems to be more prevalent in certain races, possibly due to genetic polymorphisms.